Welcome to our first Perinatal Psychology Conversations with Perinatal Psychology podcast. We've decided to kind of brand this Maternal Mental Health Matters, both for you and your children. And we're going to start our first podcast with just talking about what is maternal mental health and why it's important. So I've got with me today Dr. Donna Rutherford. So Donna, could you introduce yourself?
Yeah, really glad to be here chatting about this with you today, Hannah. I'm Donna Rutherford. I'm a psychologist with the Maternity Mental Health Service. So clearly this is a topic I feel very passionate about, and I'm really glad to be sharing that with others today.
And I'm Dr. Hannah Wilson. I'm a consultant clinical psychologist who leads the perinatal service on all things psychology related. So we're just going to have a chat about what mental health and maternity services and why we think it's important in maternity worlds, in the realm of becoming parents. So I'm just going to ask you a few questions, Donna, if that's all right. So the first one is, what is maternal mental health?
Well, mental health is kind of how we're doing emotionally. When we think of health, I think people often think immediately, don't they, about physical health. And just like we all have physical health. And it might be good, it might be bad, it might be indifferent, it's different on different days or weeks, but we all know that we all have physical health. And I guess mental health is that emotional side of our well-being. And in just the same way, we all have mental health. And it might be good, it might be bad, it might be indifferent, it might be different on different days. And then, of course, our mental health and our mental well-being affects how we feel inside, how we might be with other people, what we feel able to do, the decisions that we make. And then when we talk about maternal mental health, we're talking about that emotional well-being and mental health during pregnancy or in that period of becoming a parent.
Yeah, so it's about that, how your mental health is faring during this journey and transition into pregnancy, into the early days of parenting, and around that first year into parenting.
Yeah, it's a big life event.
It's a big life event, isn't it? And I guess that brings us on to that next question, is why is it important to focus on maternal mental health?
I think it's important because I've already mentioned we all have mental health. This affects everyone. It's really relevant for everyone to just tune in to how they're doing and what's their well-being like. And it is such a big life event, becoming a parent. And of course, it can be joyful and it can be exciting, but it can also be stressful and a bit scary. And that will depend on kind of a whole host of other things that are going on in your life. But what we know is that 1 in 4 or 1 in 5 people will experience some struggle with their mental health during this time of their life. And it's and we need to be talking about that. When we don't talk about that, when we don't make that just as much of a conversation about, what are your iron levels? Or
what's your blood pressure doing?
Yeah, exactly. When we don't make that as much of a conversation, we leave people feeling really alone when they're struggling.
And I was just thinking, as you were saying there, Donna, that we know that 4 to 5 people will be suffering with their mental health at any one time, but we also know that it's the highest risk period in a woman's life to suffer with mental health difficulties, because it is just such a big life transition and change. There are so many factors happening at this time which will be impacting on our mental well-being, such as new responsibilities, body changes, sleep deprivation.
Yes.
And physical pain, like nobody talks about it's not just the pain of the birth, it's then afterwards. There's lots of things that are painful that the body has to recover from after the birth as well. So all of these factors coming together means that our mental health needs some extra care and attention at this time in our life.
Absolutely.
And I guess the other really crucial point to mention, isn't it, about, well, why is it so important? Because if you've got a healthy mum, you've got a healthy baby. Healthy mum, healthy baby. So if mum's maternal well-being is optimized, then her ability to be available to her baby means that that baby's health is also optimized. And we know that babies are emotional creatures. They're born with a full range of emotions and let us know when they're feeling frustrated and angry or sad straight away. So we need to make sure that mum and everybody around them has got their emotional resilience to be able to attend to what this little person is expressing and needing when they arrive.
Yeah. I think I hear it all the time. It's so common, isn't it, for mums to think that they have to focus on baby all the time, and they kind of take a back seat to their own needs. And so I really like that you're highlighting that actually when you want to care for your baby to the best of your ability, taking care of yourself is really vital as part of that.
Yeah. And there can be so many myths, can't there, about being scared to admit that you're tired or frustrated, and so then you don't admit it, and then you don't take care of those needs, and before you know it, it's all built up. There's so much pressure on presenting yourself as together, especially in this time, isn't there? Because there's so much pressure to get it right.
Yeah. So, it's really wanting to see that become kind of much more that we talk about that, and that we people don't feel like they're the only one who might be struggling with these things.
Yeah. So that neatly kind of brings us on to my next question, Donna, so therefore, what would be your top tips to take care of your mental well-being in this period of transition into motherhood?
Be kind. Be kind to yourself. It's easy to put lots of pressure on yourself. It's easy to to be hard, to be demanding of yourself, and actually recognizing that this is a huge time of change in your life, that there is a lot going on for you, and be kind with yourself as you go through this.
That's so important, isn't it? Sometimes we just think that the best way to get through something is to be hard and critical, or we're just used to being hard and critical on ourselves, rather than being kind can mean it's okay to take a break. It's okay to take that nap, to ask for help, to treat yourself to a nice bubble bath or whatever it might be. It might not be the solution to all your problems, but in that moment, a bit of gentleness, a bit of kindness can go a long way.
Yeah. All the things that you'd encourage your best friend to do. And you do it so naturally to be kind for them, and yet people don't always think to do that for themselves.
If it was our best friend, we'd be cheerleading them, wouldn't we? Saying, you're doing a great job. Well done. This is hard and you're doing it. Well done. But with ourselves, we go, oh, you're not doing good enough. So I like that one. Be kind. Any other top tips?
I would pick up on something you just mentioned, but I'd really like to highlight it. Don't be afraid to ask for help.
Yeah. Don't be alone.
Yeah. Reach out. There are ways that people can help if you're struggling.
I suppose it's that we've got used to saying that now, haven't we? It's okay to not be okay. Yeah. And actually, that's more normal than we think.
Yeah.
There's support there. I guess the other thing, I think a top tip for new parents is get rest when you need it. Like attend to the simple things. So simple things really help our mental well-being, don't they? Like eat, rest, go to the toilet.
Yeah. And it's so hard, isn't it, while you're juggling baby and everything else, and then trying to kind of cook for yourself. I know that can be such a challenge for people. So if you can it's sometimes it's thinking ahead a little bit, isn't it? How can you make this as easy for yourself as you can? Get somebody in your family who loves cooking to make you I don't know, a week's worth of lasagna that you can put in the freezer and you can just reheat sometime when you need it.
Don't be scared to ask somebody to run the Hoover around. And I guess so it's that's why it's so important to attend to our mental well-being at this time, because we're often having to ask for things that maybe we're used to being really independent about. So ask for help. No shame in needing a bit of extra help and support. And the other crucial thing is, I think one of my other top tips is don't compare. Like how easily we go, oh, Sally next door didn't need any help with the hoovering. That must mean I'm a terrible parent. And it's like, but Sally's different. She's not you. So drop the comparisons, because there isn't a book written about how to take care of your baby. That book does not exist. And nobody else have had to have done this.
Or maybe Sally really did ask for help with the hoovering and you just didn't know about it.
Yeah. So don't compare. And I guess the other crucial thing, I think, is something about trust yourself. Trust your instinct. Any final thoughts for you about this conversation today, Donna?
I hope that some of what we've spoken about today kind of will resonate with the people who might listen. And I hope that it will make you feel a bit more comfortable, perhaps, at the next time that you're meeting with your midwife, or you're meeting with your health visitor, or you're having a chat with your friend, or that you might talk about some of these things a little bit more easily.
Yeah. So thank you everybody for listening to our very, very first podcast. If anything we have said today has affected you and you are thinking, gosh, I do need to reach out for more help because I do think my mental health is suffering a little bit at the moment, then please do talk to somebody. You can always talk to your GP, your health visitor, or your midwife. Or if you're really, really struggling and need immediate help, then you can always dial 999. They do have trained specialists in mental health care that you can talk to. So thank you very much again for listening to our very first podcast. It's really exciting. And just remembering that we are doing this because we believe maternal mental health matters, both for you and your child. Thank you.